Physician assistant. Physician assistants work under or on teams with physicians, surgeons, and other healthcare providers. A PA is a great career for anyone who is looking to work hard and put time and effort into their job, but not endure as much schooling as it would take to become a physician. PAs work under surgeons or physicians and make huge impacts in people's lives by being there for patients and families while also practicing medicine. This sounded very appealing to me because I've always wanted to go into the medical field and help others, but I did not want to endure as much schooling as it would take to become an actual physician. This sounded like a perfect compromise. Education requirements. In order to adequately become a physician assistant, a 4-year bachelor's degree from an accredited university in a science such as biology is required. Once this degree is earned, students must then complete a PA program that takes roughly 2 years. After all of this is done, one must pass the PANCE exam, which stands for the Physician Assistant National Certification Exam, in order to become an officially licensed PA. To be eligible for PANCE, you must have graduated from a program accredited by the Accreditation Review Commission on Education for the Physician Assistant as a Physician Assistant program. There are many duties that come with being a PA. These include taking and reviewing patients' medical histories, examining patients, ordering and interpreting diagnostic tests such as x-rays or blood tests, diagnosing a patient's injury or illness, giving treatment such as setting broken bones and immunizing patients, educating and counseling patients and their families, for example, answering questions about how to care for a child with asthma, prescribing medicine, assessing and recording a patient's progress, researching the latest treatments to ensure the quality of patient care, and conducting or participating in outreach programs, talking to groups about managing diseases and promoting wellness. As you can see, all of these duties are very similar to those of a physician, so this job comes with great responsibilities. The physical and mental demands. PAs are required to work long and unexpected hours and also be standing for a majority of the day. This can make it difficult to have a strong personal or family life. Most physician assistants work full-time. About 1 of 4 worked more than 40 hours per week in 2016. They may also be on call, meaning that they must be ready to respond to work requests within little notice. The work environment and travel requirements. Most PAs work in hospitals or doctor's offices. PAs are expected to be very familiar with medical equipment and tests because that's what they will be using on a day-to-day basis. The only traveling PAs are really expected to do is going to medical conferences and seminars in order to learn more about medicine. The majority of PAs see their patients in their place of work, but in some more rural areas they may make house calls. The salary and benefits. Physician assistants made a median salary of $101,480 in 2016. The highest paid earned $142,210, while the lowest paid made $65,620. The 2016 national average hourly wage for a PA was $49.08 an hour. PAs earn a high salary that allows them to exceed all basic needs and allows them to afford some luxuries. The overall benefits of becoming a PA is enduring less schooling, making good money, being able to practice medicine, having flexibility in their job, and having great job opportunities. Promotion potential. Unfortunately, there is not much potential for promotion as a PA, because that would require going back to school and earning a completely new or higher degree. There isn't much a PA can do to get promoted unless they go back to school and get their doctor's degree. Since they go through the process and program to become a PA, they are most likely stuck there, unless they want to go back to school or decide to pursue a completely different career. However, if they want to change to a different specialty as a PA, that is very possible, with minimal effort. The certification to become a PA is specific to a PA license, and to achieve a higher title such as a doctor, they would have to go back to school and get their MD. Job outlook. In the U.S., the need for PAs is continuously increasing. As the population is getting older, the need for PAs is increasing drastically. The Bureau of Labor Statistics predicts that employment of PAs in the United States will grow by 38% between 2012 and 2020. They attribute this exceptional growth to several factors, including but not limited to the need to care for an aging population, and increase access to health insurance and health care. Many healthcare facilities are turning to physician assistants to provide primary care at lower costs, especially in more urban areas and more rural areas. In conclusion, despite the extensive preparation that it takes to become a PA, the long strenuous hours, and the little room for promotion, overall, in my opinion, the multiple benefits outnumber the downfalls. Through my extensive research, I have come to realize that PAs endure less schooling than physicians, make good money, are able to practice medicine, help others extensively, and have great job opportunities that will do nothing but continue to grow. This job is perfect for me or anyone who wants a steady career, loves to help people, and wants to practice medicine without going through quite as much schooling as a licensed physician. I am very excited for the future and to continue to pursue my education in medicine and one day to hopefully become a very successful physician assistant.